My name is Mr. Ahmad Sayasneh. I'm a gynecologist and a subspecialized in gynaecology surgery. I'm going to talk to you about symptoms and signs of ovarian cancer. Remember, the majority of these symptoms, they are not for ovarian cancer. However, it is quite important to be aware of them, especially if they become more frequent and persistent. If bloating is lasting for weeks, that's definitely a very important sign to be investigated. And the advice is, please check with your GP, with your doctor, with your gynecologist to see if this bloating is caused by pressure, by a mass on the ovary, or if it's simply just one of the benign causes of bloating. Pelvic pain is very common. Luckily, majority of causes of the pain are benign causes and nothing to do with cancer. But again, similar to bloating, if the pain is persistent, frequent, most of the days, then this is definitely a sign which needs to be investigated. If you find yourself feeling full after eating only a small amount of food, this is a sign which could be related to ovarian cancer. The reason for feeling full quickly is the pressure caused by the cancer on the stomach or the pressure caused by the cancer on the bowel. And it is definitely a sign which needs to be investigated if it becomes persistent, frequent, lasting for weeks. Unexpected weight loss is or can be a sign of ovarian cancer. Change in the bladder habits, it can represent itself as an increase in frequency, going more often to the toilet, changing in the flow of the urine, or passing some blood in the urine. Similarly, if the tumor is pressing or the cancer is pressing on the bowel, it can as well change the bowel habits into constipation, diarrhea, or fluctuation between constipation and diarrhea, and sometimes unable to empty the bowel, and occasionally having some blood in the stool. It's very simple to seek a medical advice to check the ovaries. This is done by a very simple test called the ultrasound scan. Ultrasound scan is the standard diagnostic test to check the ovaries to make sure they are healthy and there is no ovarian cancer or ovarian cyst or anything causing of the symptoms before. So if you have any of the symptoms mentioned above, please check with your doctor. The next step will be either an ultrasound scan or a blood test or just a clinical examination.